how would you control only certain patients located in certain facilities being accessible to an external application to pull information on?
I think I'm going to give the same answer I gave earlier, which is although the expectations in the marketplace are that FHIR is going to solve many of these issues of inter-facility communications, and we hope to eventually do exactly that, we got a long way to go in terms of that authentication and access profiles. So, even in today's world, when I present as a caregiver, there's a profile that controls my access to the data that's sitting inside of here. So I may not have access, for example, to particular types of lab results or to mental health data. Those same models, right, need to apply if we're pulling data out, whether this is a continuity of care document or whether it's a FHIR API that allows me to access the data directly. Same problems of flavorizing the data and controlling access to that data through auditing. There is a big push in the security SIG. I sat through a 2-hour conversation at the last working group meeting where we're talking about how do we model those auditable events and control the governance and provenance of data, right? So a parallel question is, I put data into my application here, how do I trust that data? So it's not only am I allowed to see it, but when the data goes in there, what is the provenance of that data? Is it something that another user at my institution pushed into this database, or was it a user at a remote location? Or even more interesting, of course, is was it the patient themselves that pushed the data into a personal health record or into their Fitbit, and I'm pulling that information and augmenting my my clinical record. I need to know where it came from.